For years, it's been the most trusted public health institution in America and the world.
This is probably the most turbulent time in the CDC's history.
Now the U.S. Centers for Disease Control and Prevention is in crisis.
There is disarray at the CDC tonight.
Top officials are resigning en masse.
There are serious concerns tonight about the Centers for Disease Control.
Over the past 6 months, the Trump administration axed half the agency's budget, laid off hundreds of employees, and removed 17 experts on the National Vaccine Advisory Team.
There's a lot of trouble at CDC, and it's going to require getting rid of some people.
Secretary of Health Robert F. Kennedy Jr. was grilled by senators from both parties about the CDC shakeup.
You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that.
He said his changes will fix a broken agency. Critics say he's the one breaking the system by pushing an anti-vaccine agenda.
Sir, you're a charlatan. That's what you are.
Experts around the globe are alarmed by the developments, including Toronto Dr. Fahad Razak, who chairs Canada's new National Advisory Committee on Science.
It's not just the severe job cuts, it's the misinformation right from the very top of the agency directorship. I think there is shock, really, that it's gone this far.
Razak relies on CDC data every day to inform public health policies here. But with less funding and manpower,
we don't know right now how reliable Americans will be as partners. The hollowing out of the centralized capacity of the CDC is something that we don't have an immediate replacement for.
So what is at stake for Canada?
I think this represents a new kind of threat that we need to grapple with as Canadians. So do you believe in science? Do you believe in data? Do you believe in things like public health and preventative medicine?
Those questions, too, are front and center for CDC leadership. Even new staffers who Kennedy handpicked don't last if they don't fall in line.
I think vaccines save lives.
Susan Menares was sworn in as CDC director in July. She says she was fired in August after refusing to rubber stamp revised vaccine recommendations. She pushed back in a national newspaper, writing, "If discarding evidence for ideology becomes the norm, why should parents, physicians, or the public trust the CDC's guidance?" Still, the White House defended the firing and threatened more.
So if people are not aligned with the president's vision and the secretary's vision to make our country healthy again, then we will gladly show them the door.
After Menares was dismissed, other directors resigned in protest. The CDC's chief medical officer and top officials in charge of immunization, emerging disease, and public health data.
CDC was a known entity that could be trusted. That has now been called into question.
Dr. Shannon Charlebois, editor of the Canadian Medical Association Journal, says the CDC is being eroded at a critical time. Vaccine skepticism across North America is spreading, and cases of preventable diseases like measles are surging.
Our entire country is permeable to any disease threats that emerge in the U.S. that go undetected and thus uncontrolled for any period of time.
Florida, a prime destination for Canadian travelers, is even doing away with laws that require children to be vaccinated, a move some public health officials say will lead to higher infections. Charlebois warns Canada needs to strengthen its own disease tracking. She's calling for a national vaccine registry to monitor who is most at risk.
We need to step up our own game and continue to closely monitor and pick apart that data. Without detecting outbreaks earlier and containing them, we could have catastrophes happen that outstrip the damages caused by the COVID pandemic.
How urgent is this issue?
This is urgent. We've already had infants die of measles. We are losing lives because of this.
After decades of taking scientific guidance from America, Canada must now rely on itself and find new partners in the future.